Welcome to the Courage to Be podcast with Tanya Vasallo. Before we get into this episode, I want to share with you that I'm on a mission to close the gender gap in the podcasting world so that more and more women's voices are heard. If you feel that this is something you value too, then please rate, review, and share the podcast. And in exchange, and as my way to say thank you to you, I want to give you free access to my signature course called Manifesting Abundance, which typically sells for $997. All you have to do to gain access is leave me a review on Apple Podcasts, take a snapshot of it, and send it to help.thecouragetobe@gmail.com, and we'll get you set up with access to the course. Welcome back to the Courage to Be, where we have powerful conversations to transform your life and your business. And today we have Meliors Simms with us. Welcome, Meliors.
Thank you, Tanya. It's great to be here.
Yeah, I am so curious, with this particular episode and your journey, and how did you become an oral or dental coach? What would be the right title for you? What do you
I
like
call
using?
myself a natural oral health coach.
Natural oral health coach. Yeah, this is fascinating to me because I just interviewed on another podcast Colleen. She was not a stop drinking coach, but a drinking coach. Colleen Cashman, she was talking all about drinking, and that you can still dosify it. So I love this idea of becoming like an advocate and supporting people with their oral health and in a natural way. But how did this all start? Like, what is your story with it, Meliors?
So my story is that I had really terrible teeth for most of my adult life. I don't have a professional background in dentistry or health. And I was going to the dentist really regularly. I was doing all the things that the dentists told me to do with brushing and flossing and eating healthy and regular appointments, all of that. And yet I was still always needing more fillings, root canals, other dental work done. And one day when my dentist told me I needed what would have been my 7th root canal, I was just like, no, you guys are not putting me on the right track here. This is ridiculous. I'm doing all the things you're telling me, and still my teeth are so bad. And so finally, I started researching and investigating alternative approaches. And within a couple of weeks of making some nutritional changes to my diet, I no longer had the symptoms that was supposedly needing a root canal. And I never got that root canal. And in fact, I went for a really long time without having any problems or any fillings. So yeah, it was just such a miraculous turnaround in my own personal oral health. And so, yeah.
Yeah, go ahead. I'm just curious before you continue with this. What kind of nutritional changes? Because it's definitely something that we don't think about, what were the changes, and did that stop the root canals? I mean, because the first thing everyone thinks with, your teeth, and especially with the kids, do not have sugar, or anything sugary and leaving it on the teeth. But was that the case for you, or like, what were the nutritional changes for you? I'm very curious about this.
So the nutritional change that made the big difference for me was to stop or to start eating more animal products, specifically organ meats, cod liver oil, and dairy products. And because I had been heading down a plant-based path, I wasn't all the way there yet, but I was definitely minimizing my animal products, and my teeth were just getting worse. And when I changed that direction, my teeth got a lot better really, really fast. So it doesn't work for everyone, but that's what worked for me back then.
And was that from research that you were doing? And that's what you found out? Because I mean, there's such big advocacy for a plant-based diet, and I say plant-based diet versus like vegan or vegetarian, because you could still be like a junk food vegan, and just eating processed foods versus eating plant-based. So would you say, you just mentioned that it's not for everyone, but what do you think, or in your research, what was making the difference eating these things versus not being able to get it through plants.
Yeah, so your teeth really need vitamin K2, which is a fat-soluble vitamin that's pretty difficult to get in a natural form other than from certain animal products, which aren't even like, you won't get it from eating a hamburger, for example. You've got to kind of, the organ meats and the raw dairy are the source of that. At that time, I'd never heard of the word paleo as a diet, but of course now we all know what that is. And that's probably the closest framework to what supports the teeth, but with more dairy. Yeah.
So let's go back to the story because
Yes.
I interrupted you there with the nutrition because I was just fascinated with that.
Mm.
And so you started researching, you started changing your diet, and within what amount of time? Like you had already had 7 root canals at this point?
I'd had 6. So the 6th
Wow.
root canal was my last one. Yeah. And yeah, so very quickly my oral health transformed. I just kept researching more and more, learning other aspects of natural oral health care, trying out things on myself. And because I was excited about the results, I was telling my family and friends about it. And so they were asking me for advice, just like you interrupted me to say, well, what was the thing that made the difference? So I was having these conversations over and over again with people all the time. And at the same time, I was really I wanted to work for myself. I wanted to start a business. And I thought, well, I could try sharing this information that I have learned that is so difficult to find. I knew that it was hard to find. And I could make it really accessible and user-friendly and communicate it well to people. And so 7.5 years ago, I started my holistic tooth fairy coaching business, set up a website, started sending out a newsletter, putting videos on YouTube, and it just took off because people are really hungry for this information, and yet it is so hard to find. And even when you do find sort of what I now call alternative oral health information, it's often really confusing and contradictory. And so I see my role as to kind of give people clear, unbiased advice. I do not sell products because I think that can really bias the type of advice that you're giving, and can skew your interpretation of the research if your income is dependent on a particular product. So I've chosen to go down an information path rather than a product path.
So what point should someone contact you? Like what's going on? And, like, is it when they've gotten to the root canal or they've gotten a diagnosis that they don't like at the dentist? And like, how does that work? Like, take us through the process of maybe one of your
Sure.
clients and how
Yeah.
this has showed up for them. And what does that process look like?
So usually people contact me when they've kind of reached the end of their rope with their dental problems. They've either gotten a major treatment plan or a really distressing diagnosis, or they've just been dealing with this accumulation of chronic problems and ineffective dental restorations for years and years and years, and they kind of just reach the end of their rope. But almost always those conversations go, I wish I'd found you sooner. Because if I can work with people, and very occasionally, someone will contact me and they're getting their first cavity or their first filling. And it's so easy to get them on the right track so that they'll never need to have any fillings. They can avoid any further problems in the future if we interrupt it quickly. But mostly that's not when people contact me because, humans, we wait until we're in crisis. So I help people interpret what their dentist is telling them and figure out, what is the most urgent and important priority for them if they need a dental intervention, and what they can put to the side while they work on a holistic response and see if that works and how well that works. And then I, help develop protocols that include nutrition, oral hygiene, of course. I do a lot of work with relaxing and energizing the jaw, oral posture, breath, tongue position, things like that all play a huge role in the health of the teeth and gums. And then the other element of what I do is what I call the metaphysical, and that is looking at the emotional, energetic, ancestral, psychological, environmental influences on your teeth and gum health. And that is such an important part of what I do. And that information is so hard to find and so different from what pretty much anyone else is offering, that I ended up writing a book about it because there just wasn't any information available in the English language. So I had to.
What's the name of the book so that we can look it up?
Yeah, so it's called The Secret Lives of Teeth: Understanding Emotional Influences on Oral Health.
We'll put that in the show notes. The Secret Life of Teeth, right?
Yeah, Secret Lives of Teeth. Yeah.
And oh, wow, this is fascinating. So when you get them on the right track, can you give us an example or a story of one of the clients that you might have worked on with, like is part nutrition, part, like you're saying, like certain exercises and posture of the mouth, but what other things might you do with them? If maybe you have a client story or something that, they just got a cavity or they just got, diagnosed with a root canal or something like that. And what was the turnaround? What was the transformation with that, Meliors?
Yeah, so probably the most exciting thing to talk about is regrowing gum recession, because the dentists or the periodontists say that can't be done. Once the gums are gone, they're gone. But my experience is that sometimes, not always, but sometimes you can reverse gum recession, and certainly it's relatively easy to stabilize your gums and stop them from receding further. You can close up gum pockets, which is where the gum has separated from the root of the tooth and becomes like a little compost bin for food debris to feed bacteria that causes periodontal disease. So, and that is a combination of, as I said, nutrition, so that removing some foods from the diet, but just as important to add in those foods that help the gums to regenerate, to change your oral hygiene habits so that they support the type of gum recession that you have, because gum recession can have a variety of different causes. And so really understanding why your gums are receding, which layer of the gum tissue is being affected, and then we target your daily habits in terms of hygiene and diet and jaw posture and so on to suit that particular type of gum issue. And most excitingly, doing the energetic work, which can be, meditation, journaling, sound healing, meridian balancing, working with the inner child, or maybe even the ancestors. Some people like to work with the past lives. If that's meaningful for them, then that's a way in to support healing. It kind of doesn't matter where your door to the metaphysical is. Like, you could be a real sciencey skeptic, but open to the psychological approach, or you could be totally woo-woo and like, I've got my past life princess that I have to deal with. Either way is a way to work with the physical embodied response that your body has to that emotional kind of pattern that's laid in. The story we tell about the emotional pattern is not the most important thing. It's the working with the way it manifests in your body that makes the difference. And gums really respond to that multifaceted approach, particularly where the emotional work is part of the bigger picture.
So are there things that we can do preventative, or do we need to work with you directly, Meliors? Like what kind of things can we start putting in place so that we don't have dental issues?
Yeah, of course, there's preventative things to do, and, avoiding sugary and processed foods, being really smart about how you clean your teeth. And particularly for gums, for example, often the physical vulnerability with your gums will start with brushing too hard, too vigorously, because that's how we see it modeled on the screen. Every time I see an ad for toothpaste or a character in a TV show and they're brushing their teeth and they're scrubbing back and forth like that, that's how you destroy your gums. And I'm screaming at the TV, no, don't do it. You're breaking your gums. But that's how we learn. That's good toothbrushing.
And so how should we do it? Can you give us an example? Is it
Yeah.
softer? Is it still in circles like the dentists always tell us? Or
So
like
you want to have the angle of the brush at a right angle to the tooth. This is the tooth and this is the brush. So you want to be going like that. And then you want to have the sides of the bristles being the only part of the brush that touches the gum tissue. So you can go in circles, but you have to be careful not to get the tips of the bristles down onto the soft tissue of the gum, because you can break the part of the gum tissue that's called cementum. That's like little sticky fibers that stick the gum to the tooth.
Wait, so the tips of the toothbrush should not be touching the gums. Did I get that
That's
correctly?
right. You did. Yeah.
Oh, that's good to know. So it should be more that like more towards the top of the toothbrush.
Well,
That
you need to brush along the gum line for sure. That part
Mhm.
of the tooth is where you really get the accumulation of biofilms and food debris. But you need to make sure that the tips of the bristles are touching the crown of the tooth, and the sides of the bristles are the only part of the brush that touches the gum. Yeah.
That's great. I don't think our dentist gives us all this information in the same way, but let's take a quick pause and we'll be right back. Hi there, I have something really cool for you. I want to give you free access to my signature course called Manifesting Abundance, which typically sells for $997. You can check out all the details in the show notes. All you have to do to gain access is leave me a review on Apple Podcast, take a snapshot of it, and send it to help.thecouragetobe@gmail.com, and we'll get you set up with access to the course. You can also find other free goodies in the show notes. Go check them out. Yeah, this is fascinating. We were talking about preventative. So you just gave us some tips on how to brush our teeth correctly and not eat sugar and processed foods. What other preventative things could we do, Meliors, to have good dental hygiene and prevent?
Yeah, I think one of the really important ways to take care of your teeth that you will never hear from a dentist is to use your voice. Because when we express ourselves, you are releasing emotional energy from your body. When you speak your truth, when you articulate your boundaries, when you express your emotions verbally or even just with sounds with your voice, when you don't, when you're holding back, when you're suppressing your emotions or keeping secrets or staying silent when you shouldn't, then that energy gets stuck in your mouth and it can sort of affect the teeth. This is the heart of what I wrote about in my book with The Secret Lives of Teeth, is that they will hold on to energy if it's not expressed. So being able to articulate yourself as an unrecognized part of oral health.
Wow, this is fascinating. What about grinding then? That's a big one. I mean, I know so many people, myself included, wearing like a mouth guard,
Yeah.
for preventing the grinding. And sometimes I wonder if it's the dentist, like if it's like a made up thing, like every person that comes in and they're like, yeah, you grind too much. We need to get you a mouth guard or whatever. And here goes $1,000 more, paying for a mouth guard. Can you talk to us about grinding? Where does that come from? Is it really true? Will we grind our teeth all the way to like having no teeth at all? And what can we do to prevent the grinding? Because I think there's a big portion of population that we release stress that way, with the grinding.
Yeah, and you've just hit the nail on the head, is that a lot of the time it's a stress response. It's a response to feeling overwhelmed in some aspect of your life. And particularly if you're not able to express your frustration with the cause of the stress, then that energy gets ground out in your jaw while you're asleep at night. You don't even know you're clenching or grinding your teeth, except maybe you wake up with a sore jaw or a headache or something like that. Or you don't know until you go to the dentist and they can see that the chewing surface of your molars is being worn down. That's what the dentist is seeing, and it's definitely a real thing, and it's a significant cause of both tooth problems and gum problems, is the habits of clenching and grinding. And so one of the ways that you can approach that is to relax your jaw before you go to sleep. And so I have a video on my website of a jaw massage that you can do at night before you go to sleep. I can share the link for the show notes for that. It just takes 5 to 10 minutes and it helps you to sleep better. It helps you to breathe better at night. and it will, if you practice it consistently, reduce your tendency to clench and grind for many people.
That's good. I'll definitely take a look at the video and see how I can massage my jaw to make it feel better and relax it basically before I go to sleep. And going back, so that's a great tip for those of us that grind. For those that going back to gum recession, are there other preventative things that we can do so that the gum does not start to recede besides what you were showing us of how to properly brush your teeth?
Well, eating a more mineral rich diet. So that can be quite hard to do, even if you're eating quite healthy food, because the soils that our vegetables are grown in have been so depleted of minerals, that diverse kind of array of trace minerals that's so important for our health. You only need a little tiny bit of each kind of mineral, but you need all of them. And so you have to be quite conscientious about making sure you're getting all the minerals that your gums need to be healthy.
What kind of minerals could we get them if we're not getting them from the soil, which the plants grow in and stuff, because they're deficient of that? Could we get the minerals from supplements?
You can, or you can eat seaweed. Seaweed is a great source of
Oh,
minerals. Yeah, kelp in particular.
okay, that's great to know.
Yeah.
I'm not a big fan of seaweed. My daughter eats those seaweed packet things. I don't know if
They're
that's,
not.
I was just
It's
going
the
to say,
junk
because
food of celery, of
they're more
seaweed.
processed.
Yeah,
Yeah.
yeah.
Speaking of that, so what do we, as parents, what can we teach our children to have a good dental hygiene? Like, what are some practices that we can give them
Yeah.
now as a foundation before they get older?
The number one thing I would suggest doing with your children is after every time they eat, including snacks, get them to rinse their mouth out with water. So to take a mouthful of water and just go and then swallow, and that loosens up the food debris from the sandwich or the cookie or whatever they've been eating, and or piece of fruit, and just removes a whole layer of leftover food from the mouth. Yeah.
That's a great tip. I'm trying to think what other things show up with the teeth. I wonder if some of these things work for our pets too. I actually just had my dog a couple weeks ago had this big inflammation. I mean, the eye, it looked like it was her eye that was inflamed. And when I started looking online, I'm like, I don't think it's the eye because there's nothing coming out of the eye. I think it's
Yeah.
from underneath because their
Oh,
teeth are so
yeah.
close to the eye socket.
Yeah.
And it was correct. When we took her to the vet said that she had an infected tooth and that they'd have to do an extraction, yada, yada, yada. But I wonder if these things apply for our pets too. Do you have pets or have you experimented with animals too, Meliors, or no?
I haven't done a lot of work with animal oral health, but one thing I would say is I think part of the reason that our animal companions get problems with their teeth is because they're not eating the natural diet that they evolved with. We're feeding them highly processed foods, and it's not just the nutrients, but the fiber and the texture and the ability to chew on bones and chew on tough meat and so on that helps to keep their teeth healthy.
That makes sense. I mean, luckily with our dogs, I don't feed them kibble. We do give them, chicken and carrots and potatoes and stuff. Like we cook this
Yeah.
stuff for them, but we aren't giving, I think they might be missing some of these things, like what you were saying. Like I did go to the store and they don't sell that much of like liver and, like what do you call them in English? The
The
liver,
organ
the
meat.
heart,
Yeah.
what's
The
it called
organ
in
meats. Yeah.
organs that I couldn't
Yeah.
think of the
Yeah.
name. Thank you. And the only organ I could find at the store here were like, no, we have liver. And so I cooked it in with oh my God, the dogs loved when I put the liver
Yeah.
in there because they're missing that. And I think where we're missing, I mean, I feel very lucky. This happened to my dog that's turning 16 and we have not
Wow.
done any oral surgery, dental
Yeah.
cleanings, or any
Yeah.
of those things because I feel like
Mm.
we've been feeding her well. But you're right, like maybe we're missing like on the bones and all these other things. But let's go back to human dental
Yes.
care and why it's important because if you get any type of infections in the mouth, it can travel to other parts of the body, right? Like,
Yeah.
do you have some again, stories. I love telling stories of other people or
Yeah,
clients or things,
yeah.
of like something that happened to them that maybe was critical. And then you're like, they did this particular process and
Mhm.
they were able to bypass, like yourself, no more, what do you call it, root canals or something. Do you have something that you could share with us?
So I'm just thinking of someone that I spoke to recently who was having a problem with their molars and then had a problem in her breast and on the same side. And the molars, closely connected to the breasts in terms of health impacts. And we were working on the health of her molars, and that also supported the breast inflammation to heal itself or to reduce. So yeah, but gum disease is acknowledged as affecting the heart. It can be related to diabetes. There's a lot of systemic whole health issues and autoimmune conditions that are really known associated with both tooth decay and gum disease.
And do you still support going to the dentist, and getting your checkups? And if so, how often? And how could we work with our dentist if that's something that you do suggest and support?
Yeah, absolutely. Our dentists are a really important part of our oral health, our approach to oral health. They just shouldn't be where we outsource all of the responsibility onto, dentist visit once or twice a year. I really believe we need to take a lot more responsibility for our oral health in between those dental visits. How often to go and see a dentist probably depends on, the state of your oral health, and that if you are someone who has a tendency towards decay or cavities or gum disease, then you should see your dentist more often. If you have never had any problems and your overall health is good, then, once a year is plenty, is fine. So just be smart about your particular situation, is my advice.
Thank you for that. And let's go deeper into that, Meliors. Let's talk a little bit about standing up for ourselves versus abdicating our power to our dentist because we see them, in a white coat and like, oh, well, they're the experts and they should know better. I want to talk a little bit about listening to ourselves from an intuitive
Mm,
place, and
mm,
knowing like, oh, maybe that's not the right course. Maybe I should
mm,
get a second opinion. Maybe I
mm.
should contact Meliors and have a consultation with her. Like, what's your take on this and how do we navigate the system? Because most of the time, anytime we go to a doctor, to a dentist, whatever they say, it's like, oh yes, they must know, they know better than I do, so I'm just going to follow whatever they say, and we forget to connect with ourselves. What can you
Yeah,
say about that?
yeah. I think it's in some ways we're even more vulnerable at the dentist than we are at many doctors, because the posture that we go in into the dental chair, where we're literally lying back with our belly up and opening our mouths, and then someone is looming over us who has all the power and sharp implements and is then doing things inside our mouth. It literally triggers a part of our brain that is sort of almost pre-human in that it's submissive. That's a submissive pose. If you've got dogs, you'll see if a dog feels comfortable with another dog, they'll go belly up if they're the submissive one. But if you don't feel comfortable and you have to go belly up, then it scrambles your brain. That is a conflict, that posture, when you don't feel safe, right? So we stop being able to think clearly about what they're saying and to assess it rationally, but also to intuitively know what's going on in our body, because we're being scrambled by this kind of fear and in the submissive pose. So one of the things I suggest is make sure that you're actually doing your talking to the dentist when you're sitting upright and can look them face to face. And some good dentists have that as their normal practice. They will always sit you up to talk to you at the beginning and the end and only lie you back when they're actually working in your mouth. But other dentists are just in the habit of they'll keep you lying back and talk away to you. So you can ask to be sat up for this conversation. So you can even stand up if that makes you feel more of a powerful posture. I also would recommend asking for time, or telling them you're going to take some time to think about whatever their recommendation is. There's this real sort of sales culture of selling the next appointment or selling the treatment plan at the end of the dental checkup. And you can certainly understand from a business perspective why the dentist is doing that. But you, as the customer, can say, I'm going to think about that overnight, and then I'll call back to make the next appointment, or to agree to whatever elements of the treatment plan I am agreeing to. Don't have to be pushed into doing something in that moment where you've just had someone looming over you while you're in a submissive posture, where you maybe have anesthetic in your mouth, where you're maybe being triggered into past distressing dental experience memories, where you felt powerless, where you got hurt, and so on. And so just take some time, step away, get your nervous system kind of calm again, and then tune into, what do I really know and understand about what my body needs? So the dentist is giving you their informed expert opinion, but they are giving it often through the lens of they're running a business, and they have, particularly if they're working in a big practice that they don't own, they've got someone else setting expectations of what they're going to come out of. An appointment with a patient is going to lead to more appointments. They'll have sales goals to meet and all of that. So you've got to take that into account. And so it's not to say that all dentists are untrustworthy or that they're only in it for the money, because I don't think that's true. But like all of us, they've got competing, conflicting priorities at work and play. And so us as the customer / patient, we need to be like really smart about how we interpret what is the real priorities and what is the less necessary upsell.
This is fabulous because I think it doesn't apply just to dentistry. First off, thank you for sharing about the posture and the submissiveness of it, because I never thought of that, and it makes complete sense. As you were saying, it made me realize that the same thing happens when we're giving birth. You know, women go into hospitals and they lie us on beds, and I chose to do a home birth. That's a whole other story. And I felt so empowered because I tried every single posture. I did lie on the bed at one point, but I also squatted. I also was hanging from a rope. And there was such a difference in feeling empowered and how I chose to bring my child into this world versus, no, you're lying down, I'm on top, you know, I'm the dentist, I'm the doctor, I'm telling you how this is done. And if you think about it, it's not even natural, you know, like for birthing, you know, like women were maybe not squatting thousands of years ago before hospitals, you know, I mean, weren't lying down, they were squatting, or they were doing like, or just look at any other animal in nature. They are not finding a hospital and lying down in a bed, and they've been giving birth to their babies for millions of years. And I had never thought about it from the dental perspective of what a submissive posture we're in subconsciously, and them coming into our mouths and then making decisions this way. I mean, that has been an eye-opener for me, Meliors. I appreciate you sharing that. But where I wanted to go with this is it doesn't apply just for dentistry. This goes for any medical examination that you're doing. You know, yes, you might be sitting, but again, I would invite everyone to ask themselves the question, you know, like, what's the doctor's intention? How much time did they have to spend with me? And then let me process the information before I agree to what they're wanting to prescribe or want me to do. So has this happened to you with other doctors too, where you've come in and advocate for yourself and say, no, you know, let me think about it. Let me go. Yes, I see you nodding.
Yeah, I apply this in as much as possible in any situation where I am the patient, the customer. I'll take my time. I'll do my own research. I will, you know, respect their expertise and, you know, the insight that they have with their specialist equipment. You know, definitely dentists and other medical practitioners know things and can see things that are beyond my capacity and I want their input, I'm going to them because are specialists in something that I need that specialty. But that doesn't mean just giving up all of my autonomy and my intelligence and my authority over my own body. So finding that balance between what's valuable from a dentist and what isn't, I will be the judge of that.
Thank you for that. That is so key, of having, because so you said before that you had 6 root canals. Wasn't the 7th one was the turning point for you? That was the straw that broke the camel's back. Tell us that story, of what happened there.
Yeah. Well, actually, I think I'll tell you the story of, I think it was my 3rd and 4th root canals, or maybe my 2nd and 3rd, but it was in my late 20s, maybe I was 30, and I went to the dentist with a really bad toothache, and I didn't know, and they couldn't figure out which was the tooth causing the problem. So they did a root canal, because that's what dentists will do when you describe a certain kind of deep pain, that's root pain, nerve pain, and they can't figure out what the problem is. Certainly that dentist at that time chose to do a root canal as just to get me out of my pain. And I was so desperate, of course I agreed to it. And I went home and the anesthetic wore off and the pain hadn't changed at all. If anything, it had gotten worse. He'd done the wrong tooth. He'd done the one next to the tooth that actually did need the root
You're
canal.
kidding me.
I am not kidding. And this is not an uncommon story. I hear this story from people, at least once a month. This is a really common experience. If you don't know which tooth it is and you're in so much pain, you're so desperate, the dentist is trying to get you out of pain. They're doing their best, but they knock into the wrong tooth an alarming number of times. So I ended up with 2 adjacent root canals, both of which failed, had to be redone by a different dentist. And then those still didn't solve the problem. And eventually I had to have both of those teeth pulled out. So that was sort of a big chunk of my dental experience, was that extremely disappointing, frustrating, infuriating, painful and expensive several-year drama around what should have just been maybe even just a filling in a tooth. It might not have even needed a root canal. I don't know from all these years later, but certainly not 2 root canals. And so when I came to this 7th root canal, or what would have been the 7th root canal, I said, I need some time to figure it out. And also the dentist wanted me to have the time because they don't like to do a root canal into a tooth that's really infected. So they want you to take antibiotics, get the infection down, because they can do a much better job then. So we'd agreed a 2-week kind of cooling off period before I actually needed the procedure. And in that time, I was able to do the research, make some immediate nutritional changes, see an immediate improvement, and just not go back. Well, I went back and he had a look and he said, oh, well, the inflammation's gone. I don't think we need to do this. I said, I agree. I'm going to see if I can turn this ship around with my teeth, with this new discovery of mine. So, yeah.
That is amazing. So would you recommend that to someone that's in so much pain that might require a root canal, and just taking by themselves some time and look for some other alternatives?
Well, certainly if you're not really clear about which tooth is causing the pain. If the source or the cause of that extreme root pain is not showing up clearly on an X-ray, or you can't see it because, it might be because a tooth is broken, or a big filling has fallen out and exposed the nerve. In those situations, you either have to have a root canal or extraction. There's really no alternative, and to stay in pain and try and solve it holistically it's not a realistic approach, and I don't recommend it. But if it's an unknown source, then do what you need to do to manage the pain and consider the possibility that you might be able to resolve this. But if it doesn't resolve quickly, then
Yes,
I'm never going to discourage someone from getting a dental restoration or an intervention when they're in extreme pain like that, because it's really hard to heal your teeth when you're in pain. And once the pulp has been exposed to, decay or infection or whatever, that is actually really hard to turn around with a natural approach.
Thank you for that. We're going to take a last minute pause before we wrap up. Hi there, I have something really cool for you. I want to give you free access to my signature course called Manifesting Abundance, which typically sells for $997. You can check out all the details in the show notes. All you have to do to gain access is leave me a review on Apple Podcast, take a snapshot of it, and send it to help.thecouragetobe@gmail.com, and we'll get you set up with access to the course. You can also find other free goodies in the show notes. Go check them out. And yes, as we're coming back from this has been fascinating, Meliors. I think it's such important information of living a life courageously and, just standing for yourself, understanding the process. What an incredible journey that you had to go through these hard moments, but the gifts that you've gotten out of it and the impact that you're having on so many other people by guiding them with their oral hygiene and understanding how to best take care of ourselves from a dental perspective. It's been fascinating. And before I wrap up, I'd love to ask you, I asked this to my guest, what's something that we can do, that our listeners can do to live a life with more courage?
I think standing up for yourself at the dentist is really important, like literally standing up, or at least sitting up to talk to the dentist. It takes a lot of courage because it's breaking out of their normal work expectations and how we've been trained to behave as patients. But if you can do that, changing your physical posture to be standing up at the dentist is so empowering, and that courage can really pay off in terms of you getting better, more suitable dental care.
Wonderful. That's great. I don't think anyone else will ever have the same answer that you just gave us of how to live a life with more courage. Definitely stand up for yourself physically, mentally, emotionally, and when you're going for your next dentist visit. And thank you so much, Meliors. This was wonderful. Thanks for your time.
Thank you. It's been a real honor and a pleasure to speak to you and your audience.
Hi there. I have something really cool for you. I want to give you free access to my signature course called Manifesting Abundance, which typically sells for $997. You can check out all the details in the show notes, and all you have to do to gain access is leave me a review on Apple Podcasts, take a snapshot of it, and send it to help.thecouragetobe@gmail.com, and we'll get you set up with access to the course.